All righty. Good evening, everyone, and thank you for joining this episode of Sowing Seeds, Failing, Making Your Setback a Comeback. We have two wonderful panelists here today, so I will go ahead and introduce our panelists, and then we have a series of questions that I'll be asking our panelists to kind of get a sense of where their heads are at and what gems they can bestow upon to us today. So our first panelist, we have Dr. Michael Harrell. He is a native of Huntsville, Texas, but grew up in Dallas. He attended Morehouse College and he participated in the Early Medical School Selection Program, an early selection program at Boston University School of Medicine. He immediately became active in his local SNMA chapter, serving as a co-president for his chapter for 2 years. He also served as the parliamentarian of the National Board of Directors, the Region 7 director, and the chairperson of the Internal Affairs Committee. After graduating from medical school, he continued to serve the SNMA as a member and ultimately chief member of the Strategic Planning Council. Currently, he serves on the faculty of UT Health Science Center in San Antonio, Texas, where he specializes in retinal diseases and comprehensive ophthalmology, as well as cataract surgery. And he was recently named Associate Residency Program Director and Director of Medical Student Education for the Ophthalmology Department. So, welcome, Dr. Harrell.
Thank you, Esther.
And we also have Dr. Chidima Achalonu. She is the immediate past chair and trustee for the postgraduate section of the NMA, which supports residents, fellows, and early career physician members. She's a pediatric emergency medicine fellow at Children's National Hospital in Washington, D.C. She completed her pediatric residency at University of Chicago, where she also served as chief resident before transitioning to fellowship. She earned her medical degree from Morehouse School of Medicine, where she was actively involved in the SNMA and continues to work closely with medical students through SNMA. Beyond her clinical fellowship, Dr. Achalonu also serves as the communication chair for the section on minority health, equity, and inclusion for the American Academy of Pediatrics and is a current scholar for the Emergency Medical Service for Children program, where she's working to optimize best practices for utilizing security and law enforcement in emergency department spaces through a trauma-enforced lens. Prior to matriculating to medical school, Dr. Achalonu earned her Master of Public Health degree from George Washington University with a concentration in community-oriented primary care, and afterwards continued to work in the school health sector through health education, health promotion, and capacity building with Chicago, Washington, D.C., Baltimore, and Alexandria Public Schools. She earned her bachelor's degree in biology and psychology at Rutgers University in New Brunswick, where she served as a resident assistant, president of the NAACP, helped to recharter the MAPS chapter on campus, and was initiated into the Xi Nu chapter of Delta Sigma Theta Sorority Incorporated. Dr. Achalonu is most passionate about building community, reinforcing a diverse physician pipeline, and promoting best practices for the care of children, especially those from the most vulnerable and marginalized populations. So welcome, Dr. Achalonu.
Thank you for having me.
So as I mentioned, we'll just have a series of questions that I'll be asking you both in regards to our topic for tonight, which again is failure making your setback a comeback? So first, to start off, how do each of you personally define failure? And has that definition changed over the course of your training and your career?
Okay, I'm coming out the gate hot. That's a good question. I think that in the beginning of my career, and this would be fresh out of undergrad and while I was applying to medical school and starting that part of the journey, I defined failure by other individuals' metrics. So failure might be not getting into medical school, failure might be not getting a good grade, failure might be et cetera, et cetera, et cetera. But these separate metrics that other individuals were setting as to what defined failure, being off track or being just slow, delayed, all sorts of different conversations. And I think that as I progressed through my career, I recognized that failure really is not in the eye of the beholder, but that there are a lot of things that we define as failure, but it's because in real time, we think that that is what we're supposed to want or what we're supposed to get, and we don't get it, we think it's a failure, when in reality, sometimes it's actually an opportunity to do something better. So for example, I got into medical school immediately after undergrad, but for lots of reasons that we can certainly get into later on, ended up not matriculating to medical school. It took me 8 years to get back into medical school. And in that time, I think it was really challenging to recognize that in the way that I defined myself and my success, it was about how young I was when I graduated from college, for example, the week before my 21st birthday, or always getting good grades, always being the smart person in class. And then now being in this in-between space where I didn't know how to define myself without books and grades and schools and teachers and evals to set that, it felt like failure. But then when I started medical school, and now I'm older and more mature, and just the experiences that I was able to bring with me to medical school, to residency, and now to fellowship, I recognize that there's no way that I would be the kind of physician that I am now, be able to do the things that I am able to do in medicine if I had gone straight through. And so it wasn't really failure. It was actually just bursting the door open as far as how to actually optimize my career as a physician.
Yeah, so I think I used to define failure in the altering terms. Any huge derailment that was threatening to um, just kill my dream. You know, now I've kind of embraced more of a to err is human philosophy, and failure is just a part of that. So now failure is more of the framework of uh, when I make a plan, if I have an expectation and I don't meet it, that's a failure. And that's okay. When you present it in that lens, you start to think, okay, I'm going to fail at a lot of things, actually. And that doesn't mean that life is going to stop or that I'm not going to be what I think I want to be or I'm not going to get where I think I want to go. That just means that, okay, I learned a way to not get there. And I don't tend to make the same mistake twice. So that means, that just means I got to do something differently. Whatever I tried didn't work. So I need to do something differently to get the desired outcome. But kind of as Chidima said, sometimes that desired outcome isn't what I needed to be getting anyway, honestly. So sometimes there's beauty in failure, there's discovery in failure, there's growth in failure. I hope there's growth in failure. But yeah, so failure is not necessarily this killer, disastrous event. It can be just a series of small setbacks that you can grow from and learn from.
Absolutely. Thank you so much. I know something that a lot of people have told me in my journey is failure is more of redirection, kind of like what Dr. Achelonu and you as well, Dr. Harrell, both said. So thank you for sharing that, both of you. And so kind of just to set the framework for our audience, why is it important, especially in medicine and academia, to reframe failure as a part of growth as opposed to a marker of inadequacy?
Oh, goodness, I want to go.
Yes, you should.
Man, the words imposter syndrome come to mind. Obviously, you can't have this conversation without talking about that. And I'm not gonna try to describe everyone's experience. I'm gonna talk about mine, obviously. So, there have been so many times along this journey where I felt like, do I really deserve to be here? Should I be here? Is this the place for me? Am I good enough for this? And if you allow someone else to define you or your success, then that is just feeding into that. And that is no way to get through this. You will not survive. You have to learn to recognize and reframe some of these negative narratives that people will put on you. The negativity will fester, it will become a part of you, it will degrade your psyche, it'll degrade your self-esteem, and then it will become a bit of a self-fulfilling prophecy, and you won't succeed. So that's definitely a big part of why it's important to reframe failure as a way of redirection, as you said, Esther, or of growth, or of changing your mindset, instead of this very negative, you can't do it, you're bad, you're not good enough, that a lot of people will try to project onto you.
Yes, absolutely. Yes. What I would add is that, particularly in medicine, it's important to reframe this idea of failure because, frankly, we've all done it. Not a single one of us can have gotten to this point that we are in medicine without some sort of defined failure, but it really does end up being redirection or just repurpose, where you no longer actually want those things that you wanted before. And the word to that and speak to that is because when we hold it inside and there's shame to it, we don't speak to it, it makes it seem, when other people are experiencing really comparable situations, that they're the only one. And then there is this horrible spiral that comes from feeling like, well, yeah, I must not deserve to be here because I'm seeing all these other people who have gotten to this point and they did it without any bumps in the road. They did it without any struggles. And there are so many hurdles that you have to jump through to get to each level that you get to in medicine, that every time you are feeling like your failures are the end of the world or the end of your career, dream crushers, as Michael had said, then there's too many chances for you to be permanently taken off that road. And we need every single one of us to be able to persevere through this journey to get to the other side, because we need more of us. So I think even from a collective standpoint, we have to be able to reframe this conversation on failure so that failure doesn't become this like secret thing that you have to suffer through in silence, or this unique experience, honestly, that only you go through, because yeah, we do all.
Another
Absolutely.
thing, really quickly, shame. So shame comes with internalizing this very negative connotation of failure. And when you feel that shame because you have failed, then that can often prevent you from actually going and seeking the help that you need. And it's easy to think, like Chidima said, it's easy to think that you're the only one failing, you're the only one who's had this experience, you're the first one to ever fail step one. You're not, I promise you. So the people in the medical school who have the fancy titles of dean and such, they have seen hundreds of students fail in this very same way. You are not unique. So once you get the comfort in being able to say, hey, this didn't go the way I think that it should have gone, this didn't go the way that I wanted it to go, I need some guidance, then you can actually go and avail yourself of the expertise of those people, and they can actually help you make what seems like the end of the world into just a part of your story and help you bounce back. But if you wallow in that and you keep it inside and you never let anyone know that you're struggling, then that can turn into a much larger problem. Bless you, a much larger problem that may be a whole lot more difficult for you to recover from too.
That's awesome. Thank you so much for adding that. I think that was actually a question I had sort of later, but since you touched on it, I'm happy to ask the question to both of you is for medical students who have either failed step one, failed a shelf exam, didn't do so well, or maybe even had to retake step two, how do you navigate that in either a personal statement, in residency interviews, and how do you ensure that residencies don't necessarily see you as a red flag? Because like you said, everyone has failed somewhere along the journey. So how do you talk about those things in interviews, etc.?
You want to go first?
Sure. Well, as someone who personally failed both step two and step three, I can say that the first part for me in being able to still include that in my narrative, but not let it be the narrative, is getting to a space where I don't define myself, my self-worth, by these metrics of grades or scores or things of that sort. When you separate your identity as a person, as a future doctor, from your identity as a student, with student being just part of who you are, I think it allows you to see your setbacks, your failures as just part of this overall story. So for every negative or for every failure, like, yes, I failed step 2. I failed step 3. When I failed step 3, I like literally the same week I failed step 3 was selected as chief resident. So obviously I'm not a full failure. There are things that I am very good at. There are things that I struggle with. And then in interviews in particular, no one wants to just hear you say like, yeah, I couldn't do it, as Nigerians say, like, because I had 2 heads, like, because there's no reason. But if you can come up with a plan, that I didn't pass, I was able to be introspective to identify that these were some of the things I struggled with. These are some of the things that I discovered about how I learn, how I study, how I manage my time. And then I'm able to apply that not only to retaking step 2, but recognizing the fact that these board exams, they don't ever go away. So using it to take step 2 and step 3, and then your specialty boards, maybe your subspecialty boards, your MOCs, and all the different ways that our governing bodies continue to take money from us in the name of examination for the rest of our career. But that's a different talk.
Yeah. So let's join this party. So I failed step 1, and then failed step 2 CK, ophthalmologist. Boom. I've done a fellowship. Boom. So it's not the end of the world. Now, at the same time, when I failed step 1, that was a big shock to me and everyone else, because I had never been the person to have trouble. I was always the person who did well on all the exams. And, so surprise, surprise, I failed step 1, right? So I remember being, just a quick little aside here. Go with me on this journey. So I remember being on a peds rotation in 3rd year, and I was about to go get feedback from the neonatologist who I had been rotating with. And she's like, this amazing Black woman, neonatologist. I was scared of her a little bit, but I had gone to like the call room, and I had gotten the email, and there's no way that I could just wait till I check it right then. So I checked the email, found that I failed, and then had to go sit in front of her and get this feedback on how I was doing on the peds rotation. So while, all the while I'm like broken on the inside, and, she's telling me, okay, you did well on this, you did well on this, you probably could have done a little better on this. And I'm like, yeah, okay. I need to leave here so I can cry, please. So there's a part of that is, yes, go lick your wounds. But another big part of my personality is getting up quickly. So I immediately called 2 people who I knew from my med school, who were 4th years or who had finished med school recently, who I knew had also struggled with step 1 and recovered from it. And I said, hey, all right, this is the situation. This is what happened. What do I need to do? Who do I need to talk to? I need to figure out how I need to restudy, how I need to retake this. What am I going to do? So I came up with a plan, and I improved my score by like 30 points. So I said all that to say, when you do make this failure, or you have this failure, you have this setback, it is a good idea if you can actually bounce back for real, like have a big improvement. And then you can say, hey, these were the circumstances that were going on. Like Chidima said, I had the time to sit down and think about, critically appraise what went wrong, what could I have done differently. I made those changes in consultation with my mentors, my advisors, and then look, I actually performed a good amount better. Okay. So that's what we want to see. So as you may have heard, I'm like the new APD for our residency program. I've been participating in residency interviews since I actually started here as faculty. I participated in interviews as a medical, actually as a medical student too, but I meant as a resident. When I was in residency, we did interviews too for residents. So what we want to see is that you actually are mature enough to take the time and think about, what could I have done differently? How did this happen? What do I need to change? And then make those changes and recover. right? That's the important thing, because we know in residency, everyone is going to have a moment where they struggle, where they don't perform as well as they wanted to. And it doesn't have to be a huge failure, but there's going to be a time when you make a mistake in surgery or you don't do this step perfectly. I need to know that you're not going to fall down into a puddle of nothingness and wither away. I need to know that you have the fortitude to figure out what went wrong, fix it, and then recover, because you have to get back in the chair and do another case right after that. So actually sitting down and thinking about how things could have gone differently, implementing that plan, and then proving that you can recover and bounce back is of integral importance. Now, the red flag thing, at the end of the day, it's going to be a red flag, period. You have to, number one, describe it in a way that proves that you are not this red flag. You are more than this red flag. This is a blemish, but everyone has blemishes, right? You have to have something else to offset this. If your board scores or your grades are something that you can't change in your application, everything else that you can influence in your application needs to be optimized and maximized. If you know that your step one, well, y'all have passed fail step one now, but if you know that your step two score is low and you're trying to apply for ophthalmology, you need to have a ton of research. You need to have absolutely stellar letters of recommendation. You need to go on away rotations and prove yourself. And you need to have a knockout interview, which means you may need to put in extra effort to practice, to rehearse, to work with mentors. Like, there are things that you can do to make every other aspect of your application undeniable. And then that makes it a little easier for people to look past, okay, he may not have done as well on the boards, but everything else is wonderful. He's going to make an awesome ophthalmologist, and we just may need to put a little more effort into helping him prepare for the boards.
Thank you for that. I think both of you, for one, sharing the setbacks that you've experienced in your medical training, but then also Dr. Harrell as an APD, kind of sharing your insight into when you're looking at applications and what you're thinking about as you look at these applications, whether or not they have setbacks. So thank you for that. So since you guys both have already touched on the setback that you experienced in your career, looking back on that setback, what was one of the biggest lessons that you learned, or an unexpected benefit that kind of emerged from it?
The cutest part is how you said setback singular. I was like, with the setback singular, what you mean? We have all in this game because which chapter of the journey are we reflecting on setbacks?
Feel free to share whatever or how many setbacks you would like.
I can't say that there have been many benefits, honestly. It's not been fun. It's an opportunity to prove your resilience, I guess. And that's a benefit. No, and so having a setback is not fun. So what have I learned from it? What could have gone differently? Over prepare. When you think you're studying hard enough, study harder. When you think you've mastered this skill, think about it in a new way. Flip it on its head. Try to do it backwards. Go try a different study technique. Ask a partner to study with you and see how they know it, how they explain it, how they frame it in their heads, because that may be the way someone asks you on your oral boards, and that's not the way that you prepared for it, and you fail. So when you think you're going hard, go harder. That's pretty much, that's it as far as the studying and the standardized testing stuff goes. As far as the clinical skills and surgery and technical skills and things like that, studying with other people is really helpful. Taking advantage of different materials or resources that may be available to you is a good idea. Figuring out how you best learn is important, but you can't just sit there. You have to actually get good at learning in different ways too, because you never know how someone's going to present it to you. They may not present it in the nice way that you learned, the tactile or kinesthetic way you learned, the visual way you learned. They may present it to you in rote memorization, and you need to be able to turn that on and do well. So you just really have to over prepare, honestly.
I laugh, but I really was quite serious when I said the funniest part was that you used the word setback singular, because there have been so many, and I would agree with Michael. They don't feel great in real time. I think that there are some, like setbacks with standardized testing, with grades during medical school, that you can certainly think through and use strategies to apply for the next one, because there are no shortage of tests. But there are some that just suck, and the benefit is not always noticeable in real time. But as you are looking back, like 10 years from now, you might look and say, I if this series of events had not happened, X, Y, and Z couldn't happen. And it could be all sorts of things. So I alluded to the fact that I got into medical school out of undergrad and didn't go straight through. So I applied to medical school, got in, and had a really rough senior year. Was trying to do a lot of things. Decided grades, was an RA, just like the definition of doing the most. And so my grades slipped. And the school that I had to go to actually rescinded my acceptance the week before the white coat ceremony. So when I talk about setbacks, that what like there's no part of that feels okay. This was almost 15 years ago. Actually, this was, oh my God, over 15 years ago at this point. But even now, still looking back at it, it's horrific. It's like really challenging, and just not the way that I'd seen my life going 15 years ago. But as I pause and kind of reflect on just the different things that have made this journey in medicine worthwhile, if that moment hadn't have happened, then none of these things would have happened. Something as simple as the fact that, like, Dr. Harrell and I are home, like, this is like one of my favorite people on earth. I am literally getting on a plane tomorrow to go and see him. So, but if I had been on any different timeline in medical school, we would not have met the way we did. We would not have overlapped. In Chicago when I was in residency and he was in fellowship, we would not be as close as we are. So like the people who have made huge impacts in your life, the experiences that have really shaped the way you think about medicine, the way you think about your role in medicine, all of them happen that each of these series of events lined up. And so would I still burn the school to the ground? Yeah, probably. But I can at least reflect on the fact that there were better for me that came from that experience. And there are opportunities to really reflect on what you actually want out of medicine, as opposed to what people say you should want out of medicine. With each setback, there are ways to redefine how you're going to go into medicine, how you're going to impact medicine. I think there's just lots of ways for you to just grow and change as a person. And from that experience, which I would say of like all my setbacks was probably the most challenging to get through, I would say that coming out of it and then being able to actually enter medical school and residency and fellowship, being able to define myself as something other than a student by other things besides these arbitrary metrics like grades and evaluations, I think was so important. Because again, like people will tell you, oh, you got a C? I mean, a C must mean you're stupid. But like, first of all, it's a C in medical school. Okay, C equals MD. So please get up off my back, right? So like when you recognize that you've got other skill sets, you have so much that makes you a well-rounded person. And one little grade, one little board exam, like it's hard. I am not minimizing it at all. And trust me, like the amount of money that I've had to spend paying the retake test, like none of this is minimized, but it is not you. It is not a reflection of you and who you are as a person. It's not your full story. And there's so much more to your narrative, and just being able to identify that there is more to your narrative than that. And you setting the narrative is most key.
One more thing, unpopular opinion. Sometimes it is you, and you need to know inside of yourself if it is you. I thought I was studying hard for step one, And then when I restudied for step one, a more appropriate way, I realized that I was not studying the right way for step one, right? Um, I know that I had more in me to give to prepare for that test, but I thought I was doing okay enough. Okay. So there is an element of I was comfortable being the smart kid, being the student who never had problems, who always, did well on exams, while other people may have, struggled around me. I helped other people do well on exams. And so I was comfortable. And so I walked into that preparing for step one period as, what I've been doing should be enough and I'll be fine. Um, there was a little bit of a laziness there, a little bit of arrogance there, and I can own that because I know that those things are in me. So sometimes you do have to be honest with yourself and recognize that sometimes it is you, and you need to take a long, hard look at yourself, do a critical appraisal of yourself and say, all right, I'm going to actually have to buckle down. I'm going to have to say no to things. I'm going to have to sit in the house for a couple months and really, really study in all of my free time because I cannot afford another $2,000 to take this test again. I can't afford for my career, my future to actually be derailed by me failing this test or failing it again. So sometimes you got to make some sacrifices and do some stuff that you don't want to do and make some uncomfortable choices so that you can actually get out of your own way.
Absolutely. Thank you for sharing that. And thank you as well, Dr. Chalonu, for sharing a little bit about your story and the setbacks that you faced getting into medical school, and then the difficulties or struggles that you had while in medical school as well. And so Dr. Harrell mentioned it a little bit about kind of like how he dealt with his setbacks and what that meant to him in terms of kind of pulling himself up by his own bootstraps and being resilient, because that's who he is. But Dr. Ashalono, I wanted to ask you specifically, like, how did you personally deal with the initial like emotional response to failing and to not getting into medical school the first time around? And Dr. Harrell, please also contribute if you have something else to add as well.
Don't forget the crying and the falling apart.
Right. I was about to say, I was like, wait a minute. I think we actually have we have similar ways that we deal with this. Like you, no, because, and honestly, like we're joking about it, but I think that when you deny yourself the opportunity to have the emotional response, it's gonna come. And whether or not it comes in a controlled space or it comes when you really no longer have the time and flexibility to still be broken up about it is the part that you can control. So, I fall apart. Me and tears hand in hand. Okay, so I mean, I'm a little Milton about it. Like there's a set amount of time, depending on what the setback is. It's like, okay, you get the day. And today you can have all the feelings, do what you want to do. Are we doing ice cream? Are we doing naps? What's our comfort item? And then after today, okay, the tears will not pay for the test again. The tears will not come up with a game plan. And then you start coming up with a game plan. But the grace that you give yourself is actually a very important part of the game plan, because if you are like, particularly, so for example, when I talked about everything with medical school, and like, let's be clear, I got into medical school the first time. Okay, I want the language to.
I'm sorry.
But things happened where I was not able to start medical school after getting in the first time. But where if I didn't actually give myself the time to mourn that time, and I think that did actually create more challenges for me because I didn't really have the time. So it was a week before the wet coat ceremony was supposed to happen, and I had decisions to make. I had to figure out what I was going to do because I had no game plan. I ended up doing a post-bac program. And so that meant like literally within days of having my entire life's dream ripped out of my hands after having moved to a new city and, gotten a lease for an apartment, all the things, I had to just start going to class and learning. And so for at least like the first couple months, there was a lot of very unplanned falling apart, which made it really hard to get things done. I mean, I remember that I wasn't telling people either, because that shame that Michael had talked about. And I remember one of my pro fights showed up to surprise me for what would have been my wet coat ceremony. Crumble. Like, I remember being in an orientation session, and someone who had done the post-bac program the year before me was talking about how like it can happen at any time, and how she got into medical school just last week. And I was like, my sweat, crumble, right? So like just was crumbling at all times. Like the littlest reminder of what I had lost would undo me. It might be while I was studying. It might be like, after I got my first bad test score, and that kind of like repeated crumbling. Oh, it's so hard to bounce back from. So I should have just like taken a month, taken a week, and just fallen apart, not had to use my energy, brain, time for anything, and then been able to shift, which is now what I do. Like, yeah, we're gonna fall apart. We have no plans until that part is done.
Absolutely agree. You give yourself time to feel the feels. You wallow in it for just a little. You cannot afford prolonged wallowing. You get up, and then the emails and phone calls start flying. You got to start talking to the deans. What can I do? What are my options? Can we get a meeting? Call your family if you need to call your family. Call that mentor, the particular mentor who can help you with good, constructive advice for this. Not the mentor who's going to sit on the phone and fall apart too, because you don't need to fall apart again. You don't have time for that. You need to call the right mentor or the right mentors, and then you need to come up with your plan. I will say, honestly, at a certain point, it gets easier. Once I've, finished med school, then residency was really the point where I felt, you know what? I don't care what happens after this. I have done this and no one can take this from me. I am an ophthalmologist. I don't care what happens next. I can fail every board exam, never get into fellowship, and I will still be an ophthalmologist, and I achieved that. So that kind of takes some of the pressure the pressure to succeed. I mean, yeah, you have your own internal pressure and there's external pressures too to succeed, but that takes this is potentially fleeting and someone can snatch this away from me at any moment. That takes that away. This is mine. I have a big piece of paper in a frame that says that I am an ophthalmologist and no one can have that. It's mine. So all the rest of this stuff, that's me doing more for me, not me doing more to prove that I can do it. So it gets a little easier because the stakes get
Different.
I don't even want to say smaller. The stakes matter less to me, honestly, but they do get different. I agree with that.
Okay. Thank you both for sharing that. I think it's so important to recognize that you can wallow, you can grieve at whatever failure or setback that you experience, but it's about how you respond after that and making sure that like I said earlier, pulling yourself up by your bootstraps and making sure, like Dr. Harrell said, you study harder or you do whatever you need to do to mitigate the errors that you made before.
And just because we talked about it before, I want to make sure that we loop back around again, that taking away the shame to it. So having your safe space of people that you can talk to about it. So either someone else who's also experienced it, like it might be in the wallowing moment. It might be like who you need to talk to transition out of wallowing into proactivity. But being able to have those safe spaces that you can say like, hey, Michael, I don't need advice right now. I just need someone else to verify, like to remind me that this is just a test. We are going to get through it. And just a reminder that there are people in my corner. So make sure that you've got those people in your corner, because I think that as productive as the wallowing is, when you are wallowing by yourself and you don't have like anchors to pull you out or people to remind, like to make sure there's a good timestamp on it, you can be in there for a deep, dark time. Or, and sometimes it might be like permanently in those wallow spaces if there's not like someone to pull you out.
Mm-hmm. It could also devolve into something more clinical like depression too. So having a partner even, I failed something last year. So having my partner be like, wow, I'm surprised because you are amazing. I know you can do this. You know you can do this. What do we need to do to help you get where you need to be? All right, you're right. I'm not terrible. I'm not trash. I actually deserve this. I can do this. I have proven that I can do this. You're right. I'm the ish, right? I got this. It'll be fine. I just got to do it again, and that's okay. So that definitely goes straight to that point. You definitely, and you keep saying pull yourself up by your bootstraps. Both of us kind of cringe every time you say it. It's really much more about your team grabbing your bootstraps and sometimes pulling you up despite your own self-sabotage or depression, honestly. So yeah.
Might be getting on the plane to go see that. Like, again, I will verify. Like, I texted Michael yesterday and it's been a month. So I'm really glad that I'm getting on this flight tomorrow because I need a friend.
And that happens. And that, what I say, that's what friends are for.
That's what friends are for. That's it.
I was in fellowship in Chicago, and she was in residency in Chicago. And this was like an awesome time for us to reconnect. And so, even when we were both super busy in the trenches, we could get together and have a glass of wine, have a bottle of wine. But that's what we needed. We needed that. You need someone to help remind you who you are, help remind you what you hold dear. And if you're spiritual or you have faith, to help remind you whose you are, honestly. So, we haven't talked about the support network and the support system and family and friends and mentors and advisors as much, but they are as much a part of this recovering from failures and setbacks, honestly, as you are, and maybe even sometimes a bigger part of it.
Mm-hmm. I'm so glad we brought this up because that was actually my next question, which was, who was that particular person or mentor or support system for you during those times that helped pull you through those difficult times? And specifically, how did they influence kind of your direction that you took after the fact?
I mean, the list is so long. I owe my livelihood in this career to so many people. And depending on what the setback is and what you need in the time, it's a different person you're reaching out to, right? So when I got the call that my acceptance for medical school had been rescinded, my first call was to my parents. Now, what transpired from there let me know that, like, in other situations, my first call actually is not to my parents. Like, I need other people to talk me off the ledge first before I go to my Nigerian parents who are like, Chidima, why are you crying? Oh, okay. All right. You're not my first call. Right. Understood. I need someone else, right? Like, I have some of my closest friends who are not in medicine. And sometimes what you need is someone to just like blow off steam with without actually having to reflect on what it is that's upset you. One of my best friends, like I mentioned, I've had like a really rough last couple of weeks. And 2 weeks ago, I got some really bad news. And I called her up and she was like, why don't you come, let's get in the hot tub. She has a hot tub in her house. And she's like, we can just drink wine and sit in the hot tub. And yes, absolutely. I felt so much better after that. So friends, those of us who are lucky to have partners, or your friends' partners, they can also be the ones to pull you out. Family members, other people in medicine, again, build, like, in each of these steps, it is important to make sure that you're building community and that you recognize who are your mentors, who are your sponsors, who are your friends, who are your enemies. You got to know what role everybody plays in your story and being able to lean on those individuals. And each day, if, like, let's say your wallow was going for a few days, like each day it might be actually a different person or a different kind of support that you need. Like in the first day, it's someone who, often it's someone who like knows you really well, like your most unjudgmental space, so you can just be a mess. And sometimes you actually have to guide people towards that. Like, today is not a day when I need advice on how to fix this. I literally just need to be a mess. And I need someone who is okay with watching someone cry, like ugly cry for many hours, right? Because not everyone is okay with that. It also could be a therapist, right? Like sometimes you're like, I actually don't want to burden my people with this because everyone's got stuff they're going through. And so maybe I actually just need a session with my therapist because I'm paying them to let me be a mess.
Um, sometimes, as Chidima alluded to, it's the friend who wants to book a trip. Sometimes you need a trip. I deserve. I need to get away from all of this, all of these people. I need to throw this study book into a corner and not see it again for a couple weeks. I need to get away, right? You need to decompress. You need to unstress, de stress. Sometimes you need that. Sometimes it's your boss at the time. I need a day. I need to take a day off. I need a personal day. I need a mental health day, whatever you want to call it. I'm sick today, whatever it is. I can't be with you. I can't be around you. So to another thing. So because I failed step one, and I was in the military, so I did HPSP. I knew that I wasn't going to be in the military match, so that means I needed to apply for a civilian internship and then go on to active duty after that. So now I'm in NRMP and ERAS trying to find a prelim internship. So match week comes around and I get the email that, of course, I didn't match for an internship because I had maybe one interview. And so am I going to go to match day at my medical school with all of my friends who are celebrating matching? No, I'm not. But what I did do, which, this all turned out to, it all worked out because one of my mentors in the medical school, he was a dean. He was actually the first president of our SNMA chapter at my med school back when he was there at med school. But he knew somebody. And UMass in Worcester had a prelim spot that was open and it was in the scramble. So I applied for it in the scramble. He called the program director for general surgery and said, "Hey, I have this person. You need to interview him." She interviewed me and they gave me the spot. So I ended up matching. And I was celebrating at home in my apartment with my partner at the time, drinking a bottle of champagne while my friends were at match day drinking champagne. So, I had decided I wasn't going to go be in that place and put myself in that place because that would have cued a crumble, a meltdown. Definitely. That would have not been good for me. But I had a person who was going to be there to support me no matter what. And then we ended up celebrating together anyway, because it kind of all worked out in a different way. So, like she said, that person or those people who support you when you've had a setback are different. Sometimes it's the same person multiple times. It depends on how long this person's in your life, but it can be different people. It can be different people from day to day, from minute to minute. It depends on what you need and who is best to help you get it. It just really, really, really depends. That's why it's important to have these relationships already in place. So you're not going to the dean after something bad has happened and it's their first time seeing you and knowing about your situation. They need to be a part of the process with you the whole time, so that, it's not now all of a sudden I need your help. I need you to intervene on my behalf. I need you to call up your contacts for me and intercede for me. You've known me all this time. You know my character. You know who I am. You have been a mentor to me all of this time. So you can speak on my behalf without me having to teach you who I am and how to present me to people. I hope we answered the question.
No, it definitely did. Thank you both so much. And so now I want to pivot a little bit and talk more about the culture of medicine and what failure is or is not in this culture. So specifically, I want to ask you both how the medical community can create a culture where failure isn't um, isn't quote unquote like the enemy, but rather is more, it's more safe and normalized, where we can have these discussions about, oh, you failed step one, so did I. Okay, now we can talk about, okay, what we did differently. So how can we create a culture where failure is normalized and safe to talk about?
In spaces just like this, honestly, it has to start with one person. So I am a person who has lots of conversations. I'm very forthright with my air quote failures. Now, it's easier for me to talk about the big pivotal failures from 15 years ago when I've gotten to the other side of it. I am now a doctor. I've completed residency, right? Like, it's hard to talk about it in real time when you haven't actually found the solution for it. So I think that there's no one solution, but as if first and foremost, we start shifting the language that we use to describe certain things. So, for example, I am a huge proponent. I tell everyone that I am on a single-handed mission to eliminate the term gap year from how we talk about the time between undergrad and medical school, because it's even the subconscious things that we do that create this apologetic nature that, oh, if you graduated from college and started medical school and they were not a spring and a fall semester from each other, then there must be some sort of failure or turmoil or setback or like something deficient that puts you in that space. When in reality, and like everyone has their own choices of what to go through, but now that I'm on the other side of having had the opportunity to experience basically my whole 20s without medical school, and then now doing medical school and residency in my 30s, there's a lot of life that I got to live, that myself that I got to discover, which I then was able to take into medicine, which frankly, if you let it, will steal who you are and or create a personality for you that is restricted, because that's the culture of medicine. So I think that just each of us being able to be comfortable where it makes sense, sharing our failures. You don't have to give all the gory details, and maybe the gorier details come one-on-one when people are seeking you out. But in spaces like this, being comfortable saying, yeah, my road was not straight. It was in fact the toll-free road that you take that sends you all through somewhere because you didn't want to pay the tolls. And maybe I should have just paid some tolls. But no, I mean, I took a very scenic route to this point that I'm in. But along the way, what I saw was in fact quite scenic. And it's what created this picture of how I see my career in medicine.
I agree with all that. I also want to add that we need to stop stigmatizing things like AOA, right? Just because someone was inducted into AOA, which is obviously an honor, you deserve that when you've worked so hard and performed so well through medical school. I'm not saying that AOA is not an honor, obviously, but when the first thing I look at in someone's application is AOA, then that just makes me feel like, oh, this person who didn't get into AOA, does that mean they're less than or something? When does AOA mean that you're going to become a great doctor? It doesn't, actually. It absolutely doesn't. It may translate to you're going to do well on the standardized exams. It very well may mean that. Okay, cool. And that's a thing. And that's, somewhat important in its own thing. But we can't, for example, when you're a residency program director and you have 600 applications that you have to sift through and wither down to the 4, 5, 6, 10 spots that you have to award to residents, during the match, you can't use a board score lower than 250 as your reference, as your cutoff. You just can't screen people that way, because there are so many wonderful people who are going to be amazing physicians, amazing insert specialty here, that did not make a 250 or a 270 on step 2, right? We can't screen people that way. That's creating this narrative and, feeding into this narrative that you have to have the best board scores to be successful in this specialty, and that is absolutely not true. There's so many other metrics to help determine if a person is a good person or not, if they're going to be a good doctor or not, if they're going to be a good trainee or not, if they're going to help make a cohesive class or not. You have to actually do the work to figure those things out. You have to get into the application, sift through it, weed through it. And I know I've been through it. I've done the work. It is hard work. And there are generally a handful of people who are charged with going through all of those applications and figuring out who they want to offer the interviews to. But we have to really find better ways of doing that. Another thing that I think maybe in some roundabout way we've kind of gotten towards is making step one pass fail. Making medical school in a lot of places pass fail. So that can promote more camaraderie and collaboration and, cooperative learning and less fighting and, backstabbing and conniving and gunning and, gunning, I guess. But, that's what medicine is. Medicine is not sitting in your clinic and being the smartest person and taking care of your patient in a silo collaboratively with other people to take care of a whole person. So, getting rid of CS, there are other things that we could do.
Step 3 needs to go entirely.
Absolutely.
We should shut down student-doctor network and everything it stands for.
Plus the medical schools that are accredited to train doctors who actually train doctors who are competent. If I have a degree from an accredited medical school, that means that I should be able to be a doctor in this country. That should be enough, right? So, instead of gouging me and, charging me $1,800, $2,000 for an exam that is virtual, that used to be in person, and you used to say that it was so much because it costs so much to put it on, but now it's virtual, it don't cost that much anymore. Why are we still paying the same amount of money? I don't get it. You're gatekeeping, if nothing else. So that is a rant that we can also go on a day.
Man, I wish we had the time for the rant, but thank you both. Dr. Shalonu, you said a beautiful analogy, and Dr. Harrell, I think especially from a assistant program director perspective, you also gave great insight as well. And I know we are a little bit over time. I just have a few more questions, if that's okay. But in your experience, or in both of your experiences, how do you believe institutions can better support their trainees after either an academic or clinical setback?
I think institutions should start by advertising from the beginning, before setbacks are even possible, that there are options. I think most people know that there's this person in academic affairs or student affairs who people go talk to when they have problems. Problems with classes, failing, grades, boards. But that person should not be the person that you only go talk to when you have a problem. That person or those people, it also probably shouldn't be just one person. It should be more of, hey, different people are going to have different pathways to all end up in the same place. If you find yourself in a situation where you think you might be having outcomes that you didn't expect, that's totally fine. Come talk to us. Telling students in the beginning, none of your experiences are going to be unique here. We have seen it all. That helps people get rid of, or at least assuage some of the shame or guilt that we inherently get when we don't perform as well as we want to, when we don't meet others' expectations, when you feel like you've let someone down or disappointed people. So being able to know and feel confident that if something ever happened, ever needed, I know that there are people I can go talk to and they're going to help me come up with a good plan, and they're not going to shame me. They're not going to stigmatize me. They're not going to put a scarlet letter on me. They're not going to threaten to kick me out of school. They're not going to try to put me on ADHD medications and send me for a behavioral analysis or something like that, which I've seen and heard in med school myself. So I think med schools need to create a safer place, for a safer environment, even for students to approach them with all kinds of varying degrees of different levels, types, and sorts of setbacks, failures, disappointments, unexpected outcomes, if you will.
I agree. The only thing that I would add, just the piece about like not stigmatizing, not putting a label of ADHD, putting people on medications. I agree. But then also on the flip side, actually creating a destigmatized and safe space for individuals to find themselves with that new diagnosis, because the number of people that I know or have heard of who like have been so high functioning and high achieving that their ADHD was actually not diagnosed until they were atypically struggling in medical school in a way that they were not struggling in any other academic space is like astronomical. It is so common for new things to resurface themselves, whether it be a new learning disability, whether it be a new mental health issue, and just being able to create like very psychologically safe and destigmatized spaces to talk about it without it being from a place of remediation, from a place of shame where, oh, because you are failing, there must be something wrong. Let's figure out what's wrong. Instead, everyone should come into medical school and be given the opportunity for, psychological testing, therapy, and just being resources that are both academic and non-academic that help you perform better as a full functioning medical student.
Also, schools should not find out that someone didn't match like right before they find out they didn't match. I've recently learned that at the current school that I'm at, UT San Antonio, the Long School of Medicine, one of the deans encourages all of the medical students to come and have a meeting with him if they have less than or fewer than 10 interviews, because that might mean that there's a higher chance that you might not match, and we need to be talking proactively before you even submit a rank list about what options might be and when are we going to pull a trigger. What are you going to do? Where are you going to be? Who's going to be around you? What's your support going to be like? Are you going to stay in school? Do you want to do a dual degree? Do you want to graduate and start looking at post-bacs? Do you want to, do a research year? Like, we really need to start thinking about that way before you get to the week before match day. Because we might need to pull in some advisors or mentors from the specific field and say, oh, okay, well, let's just go get the ophthalmology field specific advisor and figure out kind of what the actual options are for someone in your shoes or your potential shoes, honestly.
I felt so much. Wow, that was amazing. I just have 2 questions and I'll combine them since we are over time. So if you could go back and speak to your trainee self during a tough setback, what would you say? And also, what is one small practical action that attendees can take away to either rebuild or build resilience or reframe a recent failure that they've experienced?
If I could go back and, well, I am still a trainee, so going back to talk to my trainee self might be talking to me today. And honestly, I could still use this advice. So I think this is kind of a challenging question because there's a duality where there is a certain amount of resilience that we need to get through this field, but also like, fuck resilience. It's just not everything has to be you being the like strong person all the time. And I think that I blend that by saying what we were referring to before, in that you have to learn to give yourself grace. Like, it is actually okay to fall apart, and falling apart is actually part of the rebuilding process. Like, you can't rebuild something with a more sound structure if you don't actually like break down the foundation and rebuild the foundation, because it fell over in the first place because it was on rocky foundation. So I would say that, the conversation that I continue to have with myself, and I would certainly have with my earlier trainee version of yourself, is that grace is not like complacency or excusing your limitations or excusing your deficits, but grace is in fact the opportunity to open yourself up for different ways of doing things and new ways of finding success. And then, I forgot the second part of your question already. I'm so sorry.
Yeah, no, that's okay. I know both of them were pretty loaded questions, but the second question was, what's one small practice or practical action item that attendees can take away to either build resilience or to reframe the failure that they experienced recently?
I think that the support system piece is important, but if it's like one small thing, it would be the power of positive speak. So words have so much power, and you have to be really intentional about what you say to yourself and what you say about yourself. And so it seems like really silly and kitschy, but just being able to have some self affirmations that you tell yourself before a test, before an interview, before anything that you feel where your imposter syndrome might start peeking out and undermine all that you've worked for, all that you've earned, and all that you deserve. You want to be able to like put some words to power and build that resilience around it.
Hmm. So the second question, I've been thinking about it a lot. Expand your circle. Sometimes you need to swallow your pride, identify the person who did what you're trying to do very, very well, and go talk to that person. One way that my school helped me when I failed step one was they gave me a tutor. One of the other medical students who was a senior to me who had done very well, he actually tutored me, and that's how I did much better on step one when I passed the second time. And it was very interesting to me how he introduced things to me in a different way than I had been, reinforcing them and practicing them and studying them in my head. And I realized that, wow, other people are thinking about this. Other people are thinking about this in a completely different way than I was thinking about it. And maybe if I would have been talking to other people, I would know that people have just like framed this differently in their heads. And maybe yes, I was practicing, I was regurgitating, I was memorizing, but if you're studying it the wrong way, then you're learning it the wrong way, and you're just going to make the same mistake on the exam. So sometimes you need to expand your circle, stop talking to the same people you've been talking to, the people who are going to reinforce maybe your bad habits or reinforce um, unproductive or unhelpful things, and talk to someone who may see it or think about it differently than you. Sometimes that means going to um, the advisor in the office, the dean's office, who you don't really click with, you don't think they see it for you. That may mean you need to go talk to that person, because that person is going to give you some honest advice, some good feedback. Maybe they may also be framing it and thinking about it in a different way than you have been, and that may be the key to your success in the future. Now, you're going to have to remind me about the first question.
It was so the first question was, if you could go back and speak to your trainee self during that tough setback, what would you say?
Um, I'm trying to think of a particular one because there are multiple, like you said, multiple setbacks. I think I would say what I did say, because it helped. You can do this. I've kind of said some of this already through this hour. You are deserving. You are not trash. You are not dumb. You have proven this already. You just need to buckle down and do the uncomfortable thing. You need to figure out how to make yourself study more hours in the day, even when it's uncomfortable, even when you're tired of doing it, even when you're bored, even when you think you've read enough. You need to go harder.
Mhm.
Um, and when I did that, it generally turned out good results because honestly, when I did that, I was probably putting in as much work as everyone else was already putting in the first time, and I wasn't, honestly.
Mhm. Awesome. I know we are well beyond the hour, and I'm so, so sorry, but I thank you both so much, so much, so much for your time. I think this is such an important conversation to have, and you both have really shed light on this conversation. Like you said, Dr. Achalono, it's so important to have these conversations to normalize failure because everyone goes through it. So, with that, I thank you both once again so much. Thank you to our audience for listening, and I hope you both have an amazing night.
Esther, thank you. These were awesome questions. You facilitated and moderated a great conversation. We appreciate you. I honestly, personally appreciate you guys for inviting us, and am always happy to support the SNMA in anything that you guys are doing.
Thank you
Thank
both
you
so
so much for
much.
having us.
Likewise. Yep. Take care. Thank you.
I guess.